I'm Dr. Sanjeev. Hi, everyone. I'm Dr. Sanjeev Goel, and you're listening to another edition of my Go Live Peak Human webinars. And today I want to talk about the use of oral minoxidil for basically hair loss. Female pattern hair loss is specifically what we're talking about today. But there's a study that came out that I thought was really interesting. And I wanted to first maybe take a little bit of background on why I think this is so interesting and why this is useful information. So I get a lot of people coming into me asking me about what they can do for hair loss, and men and women. Surprisingly, a lot of women come in for this concern. We do have a couple of medications, but they're not that successful. Um, Traditionally, one of the medications has been the use of something called Rogaine, which is minoxidil. And minoxidil was a blood pressure medication. It was first discovered, about 30, 40 years ago. And what they found was that it helped with lowering blood pressure, maybe not the best type of blood pressure pill, but it also seemed to cause the patients to actually increase their hair growth. And the reason that it wasn't given orally for hair growth is that people also grew hair where they didn't want to grow hair, so on their face and things like that. So in the doses it was being used for blood pressure, it was also causing like facial hair growth, which is definitely a concern, or on the arms or legs. Um, so for that reason, it moved on to a topical application. So traditionally, the use of minoxidil has been topical, and you could buy it at the pharmacy, for 4, 5%, 6%, up to 8%. You could get it compounded of minoxidil. But the problem has been with this medication is that it's just not easy to use. You have to put it on every single day. It has kind of a greasy film. People don't like the way it feels in their hair. And for that reason, it's really, not really used that much. And people are moving on to other types of medications like DHT blockers. But this study, I think, points to a way of giving minoxidil that's effective and without much side effects. And so I want to talk to you about this study. So basically, it's a study published in 2020. The author is Rodriguez Barata, and the title is Low Dose Oral Minoxidil for Female Pattern Hair Loss, a Unicenter Descriptive Study of 148 Women. So basically, what they did was they took women with female pattern hair loss, people who were unresponsive to the current treatment they were on, and they added oral minoxidil. So, like I said, the dose of minoxidil for blood pressure was something in the range of 5 or 10 milligrams a day. But here they only gave 0.25 milligrams to 2 milligrams with a mean dose of 1 milligram. And so the mean age of the study participants was 47 years of age, but there was a wide range of age, all the way from age 17 to 85. And so basically, the women kept the treatment they were on. Some women were on no treatment, a small number of them, 23 patients out of the 148 received monotherapy, low dose oral minoxidil. The rest were on some type of combo. But the results were pretty surprising. So basically, 30 patients showed stabilization of their alopecia. That's 20%. 118 showed clinical improvement. And of these, 95 patients, or 60%, showed slight improvement, and 23 patients, or 15%, showed marked improvement. The way they did this was 3 independent dermatologists looked at this, they took photos, and all 3 of them had to agree that there was improvement for the patient to classify as improvement. They did not have any side effects. The women did not notice any hair growth issues, because that would definitely be an issue. There was really no side effects that they noted, no blood pressure issues. And a number of them were on a whole bunch of other different therapies. But the important thing to realize here is that they were not noticing any improvement before getting to the study for at least a year. So what that is saying is that the oral minoxidil likely made the impact here. But again, we need more studies. But what I would say here is that if you're considering what type of treatment you can do if you're losing hair, especially for women on this study, and you've tried the other things on the market, such as PRP, the DHT blockers such as deutericide or Propecia, or spironolactone or low light therapy. If you tried all of those things and they haven't really brought you the results, I think the study shows that low dose oral minoxidil seems like a good option and worth it, definitely a try. So that's it for me today. I hope that you enjoy the rest of your day today, and we'll talk to you soon.